Have you been waking up at night because of the urge to urinate? Do you sometimes feel like you're visiting the restroom too often during the day? And have you ever wondered, is this minor issue something to worry about? Be careful. Frequent urination, or nocturia, or nighttime urination, or changes in urine characteristics can be early warning signs of serious health conditions such as diabetes, kidney disease, hormonal imbalances, or even cancer. Did you know? Urine is not just a waste product. It's actually one of the most natural and reliable health indicators your body offers on a daily basis. From color, odor, frequency to the sensation during urination, everything is saying something about your internal state. Unfortunately, most of us unknowingly ignore these important signals until it's too late. Don't wait until your body is screaming for help. Start listening to the early whispers from your urine. It reveals more about your health than you think. How many times a day is normal? Once people recognize the importance of urine as an internal signal, the first question that usually arises is, so what's considered normal? On average, a healthy adult urinates about 6 to 8 times per day. However, this number is not fixed and can vary depending on several factors, such as the amount of water you drink. Obviously, more fluid intake results in more urination. Weather and temperature. Hot weather leads to more sweating and less urination. And physical activity levels exercise also causes sweating and reduced urine output. Therefore, urinating anywhere between 4 to 10 times a day can still be considered normal, as long as you feel healthy and do not experience symptoms like urinary urgency. Frequency, or dysuria, painful urination. Seemingly minor signs, but never to be taken lightly. While many people think urination is just normal, nothing unusual, in reality, small changes in urinary habits can be among the earliest warning signs of silent imbalances happening inside the body. Nocturia more than 1 to 2 times per night. Physiologically, nighttime is when the body rests, and the urinary system slows down. Therefore, waking up multiple times at night to urinate, especially more than twice, not only affects sleep quality, but also warrants attention. This could be an early manifestation of endocrine disorders, such as diabetes or hyperthyroidism, reduced kidney function, or cardiovascular conditions that cause fluid retention, urinary urgency, frequency, or incontinence. These symptoms are not only disruptive to daily life, but also reflect potential abnormalities in the bladder or the nervous system that controls urination. Common causes include cystitis, also known as bladder inflammation, benign prostatic hyperplasia BPH in men, or overactive bladder OAB syndrome. Additionally, neurological conditions such as Parkinson's disease, musculoskeletal, spinal cord injuries, or long-standing diabetes may disrupt urinary control signals. A noticeable change in urinary frequency, whether it increases abnormally or drops significantly, should not be overlooked. For instance, if you normally urinate 6 times a day and suddenly find yourself going 10 to 12 times without any change in fluid intake or lifestyle, that's a sign to stop, listen to your body, and consider seeking medical evaluation. Don't wait for your body to shout before you take action. Health always sends subtle signals, and your urination pattern is one of them. Tuning into your body's smallest expressions is key to detecting and preventing disease more effectively. Why do you urinate frequently or at night? When you begin to notice that you're urinating more frequently than usual, especially during the night, it's not always just because you drank too much water. Your body may be trying to send you a signal. To fully understand this, we need to examine the most common causes behind frequent urination and nocturia, nighttime urination. Urinary tract conditions, when the defense line is under attack. The urinary tract includes the kidneys, ureters, bladder, and urethra, the system responsible for producing, filtering, and eliminating urine. When any part of this system is compromised, the normal excretory mechanism can be disrupted. Urinary tract infection, UTI, a very common cause, especially in women. Symptoms often include a burning sensation during urination, urgency, frequent urination in small amounts, and sometimes low-grade fever or foul-smelling urine. Kidney stone, bladder inflammation, or kidney failure. These conditions directly impair the filtering and storage of urine. Moving kidney stones can cause severe lower back pain, hematuria, blood in the urine, and in severe cases, acute renal failure if not treated promptly, prostate enlargement or prostatitis in men. These conditions obstruct urine flow and prevent complete bladder emptying, leading to a constant urge to urinate, particularly at night. Overactive bladder, also known as OA or pelvic floor dysfunction. These conditions cause involuntary bladder spasms or weak urinary control, resulting in urgency, urge incontinence, or an inability to hold urine. Systemic conditions, internal disorders that impact urination. It's not just the urinary system, but many systemic diseases can also lead to frequent urination and nocturia. Diabetes, especially poorly controlled type 2 diabetes. High blood sugar levels cause the body to excrete excess glucose through the urine. This leads to dehydration, increased thirst, and consequently, more fluid intake and urination. It's a dangerous and often overlooked cycle. Heart failure or chronic kidney disease. These conditions cause fluid retention during the day, which is then excreted at night as the body attempts to restore fluid balance. Hormonal disorders in pregnancy. Hormonal changes increase blood flow to the kidneys, enhancing urine production. Additionally, the growing fetus can put pressure on the bladder, leading to frequent urination or urinary urgency. Side effects of medications and medical treatments. Many people are unaware that the medications they use daily may be the underlying cause of frequent urination. Diuretics or water pills, commonly prescribed for high blood pressure, heart failure, or leg swelling, for example. Hydrochlorothiazide, furosemide, spironolactone. These are leading causes of increased urination. Caffeine and alcohol. Both are natural diuretics that stimulate the bladder, increasing urine output and creating the sensation of needing to urinate frequently. Chemotherapy agents such as cisplatin and pelvic radiation therapy. These treatments can cause inflammation or irritation of the bladder and urethra, leading to increased urinary frequency. Pelvic trauma or surgery can pose risks to bladder function. Individuals who have undergone hysterectomy or prostate surgery, radiation therapy in the genitourinary area, or experience pelvic musculoskeletal trauma are at risk of damage to the neuromuscular system that controls the bladder. This damage can result in long-term urinary disorders, urinary incontinence, or chronic nocturia, all of which can significantly affect quality of life. In summary, frequent urination and nocturia may stem from various causes, ranging from mild infections to serious chronic diseases. The key is not to dismiss these signs. When these symptoms persist or appear abnormal, it's crucial to seek medical attention promptly to identify the underlying cause and prevent potential complications. Urine, a mirror reflecting your internal health. After understanding the normal frequency of urination and the potential causes of frequent urination or nocturia, it's equally important to pay attention to the characteristics of your urine, specifically its color, odor, and appearance. Though urination is a daily physiological activity, urine actually serves as a biological mirror, reflecting the health status and function of multiple internal organs, particularly the kidneys, liver, and urinary system. What does urine color indicate? Urine is the final product of the blood filtration process carried out by the kidneys. Therefore, the color of urine not only reflects hydration levels, but can also signal underlying metabolic disorders or medical conditions. Pale, clear yellow. This is the ideal urine color for a healthy individual. It indicates that the body is well hydrated and the filtration and excretion processes are functioning normally. Dark yellow or orange. This may signal dehydration. As the body concentrates the urine due to insufficient fluid intake, orange-colored urine can also appear in people with high fevers, those taking high doses of B vitamins, or individuals with liver dysfunction due to elevated bilirubin levels in the blood. Red or pink. This is an important warning sign. Reddish urine may indicate the presence of blood in the urinary tract. Known as hematuria, causes can include kidney stones, infections, trauma, or even malignancies such as bladder cancer, prostate cancer, or kidney cancer. However, consuming deeply pigmented foods like beets or berries can also cause temporary color changes, which typically resolve within 1-2 days. Green, blue, or pale purple. These are very rare colors. If observed, they may be related to side effects of certain medications, such as antidepressants or anesthetics, artificial food coloring, or infections caused by Pseudomonas bacteria. Although uncommon, if such colors appear without an obvious cause, a medical consultation is advised. Cloudy or foamy urine. Cloudiness may result from pus or inflammatory cells due to a urinary tract infection. Persistent foamy urine that does not dissipate may suggest the presence of protein in the urine, indicating impaired kidney filtration, an early sign of chronic kidney disease. Urine odor, aroma that reveals hidden health clues. In addition to color, the smell of urine can also provide important clues. Although urine odor can vary slightly depending on food or medication intake, noticeable and persistent changes are often a sign of abnormal conditions in the body. Strong ammonia-like odor, common when the urine becomes concentrated due to dehydration. Reduced urine volume increases the concentration of waste products, creating a strong, pungent smell. Sweet or fruity odor, a hallmark sign of poorly controlled diabetes. When blood glucose levels are excessively high, the kidneys begin excreting glucose in the urine, which produces a sweet smell. If this symptom is accompanied by excessive thirst, weight loss, and fatigue, a blood glucose test is urgently recommended. Foul or fishy odor. This is a concerning sign often associated with urinary tract infections. Bacteria can break down compounds in the urine, resulting in a foul or pungent smell. Other accompanying symptoms may include burning during urination, cloudy urine, and increased urinary frequency. Urine test, a simple way to perform a comprehensive check. After paying attention to the color, smell, and characteristics of urine with the naked eye, the next step to better understand your health status is to perform a urine test, an extremely simple, minimally invasive method with great diagnostic value. This is the chemical window to look deeply into the functioning of the kidneys, urinary system, and many other related organ systems, such as the liver, pancreas, and cardiovascular system. What can a urine test detect? A general urinalysis is a routine medical tool that helps doctors assess many factors through your urine sample. The test results can provide early signs of urinary tract infection (UTI) through the presence of white blood cells, nitrite, a substance secreted by bacteria, or pus cell. Patients often have symptoms such as painful urination, frequent urination, or cloudy urine with a foul smell. Kidney damage. If protein is found in the urine, proteinuria, it indicates that the kidney's filtration function is impaired. Additionally, if red blood cells, blood, renal tubular cell, or persistent foam are present, chronic or acute kidney disease should be considered. Diabetes. The presence of glucose or ketones in the urine reflects uncontrolled high blood sugar. In severe cases, it may indicate diabetic ketoacidosis, a medical emergency. Liver and metabolic disorders. Bile pigments, bilirubin, urobilinogen, occult blood, or changes in urine color may indicate hepatitis. Bile duct obstruction, or metabolic disorders such as porphyria. Important indicators in urine tests, health codes from your body. A urine test is not simply about checking for infection. In fact, just a few milliliters of urine contain a lot of valuable biological information. helping to paint a picture of the body's internal balance, kidney function, and potential metabolic disorders. Below are the most noteworthy indicators. pH, acidity, alkalinity of urine. Normal urine pH typically ranges from 4.5 to 8.0. If the pH is on the acidic side, meaning below 5.5, it could be due to a diet high in animal protein, dehydration, or conditions like metabolic acidosis. On the other hand, if the pH is more alkaline, above 7.5, it's often seen in urinary tract infections caused by bacteria that break down urea, or in diets that include a lot of green vegetables and alkaline foods. Changes in urine pH can be early warning signs of infections, kidney stones, or metabolic disorders. Urine-specific gravity reflects the kidney's ability to concentrate and dilute urine, and it also serves as an indirect measure of kidney function. Normal values typically range from 1.05 to 1.030. A high specific gravity, above 1.45, indicates concentrated urine, which could be a result of dehydration, fever, or the presence of abnormal levels of glucose or protein. On the other hand, a low specific gravity, below 1.010, may indicate kidney failure, where the kidneys lose their ability to regulate water and electrolytes. Monitoring specific gravity over time helps assess kidney filtration efficiency and the body's response to various physiological or pathological conditions. The presence of cells or abnormal components in urine can act as a red flag for many diseases. For example, red blood cells in urine can indicate kidney damage, glomerulonephritis, kidney stone, or urinary tract cancer. White blood cells often signal a urinary tract infection. Epithelial cells may appear due to normal shedding, but excessive numbers could point to chronic infections or ureter conditions. Bacteria in urine typically confirm a urinary tract infection. Urinary casts, which are cylindrical structures, may suggest tubular damage, nephritis, or toxicity. Finally, crystals in urine, which can form an overly alkaline or acidic urine, may be precursors to kidney stones. Why are urine tests important? Among various health screening methods, urine testing is one of the simplest yet most effective ways to decode internal health conditions. Diseases such as diabetes, kidney disease, infections, or metabolic disorders can silently develop over months or even years without obvious symptoms. By the time the body shows abnormalities, the disease may have already progressed and become harder to control. That's why urine tests not only help detect abnormalities early, but are also tools for monitoring treatment effectiveness and assessing disease progression over time. This is why doctors always recommend periodic urine testing, especially for high-risk groups such as the elderly, people with pre-existing conditions, or those with unhealthy lifestyles. Especially in modern society, where diets are often unbalanced, physical activity is limited, and psychological stress is common, regular urine testing should be considered an essential part of comprehensive health checkup packages. It not only helps with early disease detection, but also plays a crucial role in long-term prevention and health protection. A valuable message from the body that we need to listen early. In the busy rhythm of modern life, we often overlook small signs that carry great meaning from the body, and urine is one of them. Many people see urination as a normal physiological act, but in fact, it is a silent language that the body uses to warn of underlying disturbances happening inside. From the number of times you urinate each day, to the color, smell, cloudiness, or the feeling during urination, all of these can clearly reflect the health status of the kidneys, liver, prostate, urinary system, blood sugar metabolism, or even cardiovascular and endocrine diseases. If you start urinating more frequently during the day, especially at night, experience urinary incontinence, have urine with an unusual smell, abnormal color, or persistent foam, these are no longer simple signs. They are warnings. What matters is, don't panic, but don't ignore them either. Here's what you can do. Listen to your body every day. Drink enough water based on your need. You don't have to force yourself to drink too much. But make sure you're not dehydrated either. A simple rule is to drink whenever you feel thirsty or if your lips, throat, or skin feel dry. Don't hold in urine for too long. Urinate as soon as you feel the urge to protect your bladder from infections or other issues. See a doctor early if you notice any unusual signs that persist, like painful urination, urgent urination, blood in your urine, cloudy urine, or persistent foam. Finally, get regular urine tests as part of your general health checkup. They're simple, inexpensive, and can provide valuable information about your overall health. Finally, remember, urine is not just waste, but also a mirror reflecting your health. Listening to and understanding the body's language from even the smallest signs, that is the first step to a smart lifestyle and proactive long-term health protection. Conclusion. Take action today to protect your health, starting from the smallest things. You don't need to be a doctor to understand what your body needs. By observing silent signals like urine, you can detect many health issues early before they become serious. From nighttime urination, frequent urination, changes in urine color, unusual odor to painful or difficult urination, all can be warning signs the body is sending to you. Pay more attention every day. Drink enough water when you feel thirsty. Don't hold your urine for too long. Proactively seek medical attention when there are unusual signs. And don't forget to get regular urine tests, a simple, low-cost method that can provide a wealth of valuable information about your overall health status. Health doesn't always require grand actions. Sometimes, timely attention to small things is the key to preventing disease and maintaining quality of life. If you find this article helpful, share it so your family and friends can better care for their health every day. Who knows? Just one small action today might help someone avoid serious consequences later.